probably transplantation and cellular therapy is one of is a clear example where international collaboration is really needed. So it's a very specific treatment that at the end of the day is not being given to a significant number of patients, at least if we compare these numbers to other potential strategies. The reason for that is that hematological malignancies are less frequent, for instance, than solid tumors, and the major indications for stem cell transplantation are oncohematological malignancies, basically leukemias and lymphomas and plasma cell disorders. So if we compare the incidence of these diseases in relation to others, they are significantly less frequent. And of course, we are not applying stem cell transplantation to every single one of these patients being diagnosed with these diseases. So in order to have enough patients to do studies that can give strong and significant conclusions, we need cooperation. And this cooperation can be done nationwide, and there are quite a lot of national registries that have the objective to gather enough number of patients to be able to analyze risk factors and long-term outcome in big numbers of patients. And of course, if we move one step beyond, this cooperation can go to the international level. And in fact, we have quite a lot of international stem cell transplantation and cellular therapy registries that have basically the same objective that the national registries have. And on the top level of that is the cooperation between international registries or amongst international registries. And this presentation is basically looking at the cooperation between the European Stem Cell Transplantation and Cellular Therapy Registry, which is the BMT, and the International Center for Stem Cell Transplant and Cellular Therapy, which is basically the registry that it's based in US. So from a scientific point of view, and from a professional point of view, an intellectual point of view, it's really very interesting in thinking about the possibility to implement this cooperation. This cooperation has been going on for many years, so we have quite a lot of examples to demonstrate that this cooperation is really successful, and the data coming from this cooperative analysis have really changed, in some cases, the standard of care for our patients. But of course, we need to implement these cooperations. Things are getting more and more complicated because we have more and more patients included in the registry. We want high quality data to be picked up from our patients. So this means really high technology systems to be able to support, and good platforms to support this amount of data collected as much as possible real time. We need to put in place technology for data sharing, and to try to avoid as much as possible that different centers report clinical data from patients to different registry, which is time consuming, and it represents quite a lot of human resources and money dedicated to that. And then of course, from a regulatory point of view, there are new questions coming in from data privacy, transparency, and patient rights that also need to be taken into consideration, and that have already been taken into consideration by these two societies and these two registries. So it's really important in the transplant field to have this international cooperation, but we need to work quite a lot with the different partners to make it possible, and to make it really a reality, and of course to be compliant with all the different global regulations that are much more stronger in the last few years.